and we'll get started. First, I'll allow Evelyn Rosa to introduce herself and her colleague as well. I believe that she'll be joining us as well. So, all you.
Hi, good morning, everyone. Again, my name is Evelyn Rosa. I'm one of the managers for patient access at New York Presbyterian Weill Cornell. I manage the Alexander Cohen Women and Newborn Hospital here at the side. So I'm just going to give you, I have with part of my team is here, Sharon Eiffel, who's our senior birth registrar. I have Jessica De La Cruz as well, who's one of our birth registrar, and Nicole Page is also here, who's the supervisor. So I'm going to start off, and then Sharon is going to chime in just to give a little bit of our process. I will say that we have last year, to 2024, we had 8,953 births. To date, from January to date, we have over 6,000 births as of now. Approximately average per month, we have 750 births and about 25 to 30 births per day. I will let Sharon continue on our workflow, especially on capturing AOPs. Sharon?
Hi, good morning. In our hospital, we keep 2 logs for the births. We have a digital log in our Epic system, but we also have a manual log that's maintained by the labor and delivery staff. Every time a newborn is born, it generates in our system, and we also document it on paper, so we have backup. Those logs are from midnight to midnight of every day. When we come in the morning, we pick up that log from the labor and delivery unit and we compare it to our digital log in Epic to make sure we capture every birth. From that log, we go into the system and we check the marital status of every patient that delivered the day before. For every patient that is single, domestic partner, significant other, divorced, widowed, legally separated, unknown, anything that does not say married, we literally visit that patient and we confirm their marital status. We update our system. If they are not legally married, we advise them of the acknowledgement of paternity form. We give it to them. We explain it. We explain the purpose of it. We explain how to fill it out, that it has to be signed by both parents. Both parents have to have ID, and it'll be witnessed by either the nursing staff or the birth certificate staff. After we receive the worksheet, we double check that for every single parent. We also received an acknowledgement of paternity form, or in some cases, mothers will advise us that they're not adding dad at all for whatever reason. We confirm that for every single parent, an AOP is received or no dad's information. If there's any discrepancy whatsoever, we call the mom and we confirm we received the worksheet with the dad's information but no AOP. Oh my God, I forgot. And we give them time to fill it out and we obtain it. Otherwise, we advise them if we do not receive the acknowledgement paternity form that's witnessed and signed by both parents, then we can't add dad. Our system works for us because under patient access is also the registrars in the labor and delivery area. And they're aware of how important it is to ask parents, are you legally married? Because when someone is pregnant, sometimes they're uncomfortable stating that they're not legally married. We try to explain to them it's not about judgment. It's so that you can have the correct paperwork. And that tends to work for us. The biggest problem we encounter are the patients that still say they're married even though they're not. And we have captured some of those patients via the nursing staff, because our nursing staff is also aware of the acknowledgement of paternity form. They're the ones that witness most of the AOPs. And they will also ask, are you legally married? And they have captured some of the patients that come in and say that they're married when they're not. I am not saying we don't miss anyone, but if we do miss someone, it's totally because they gave us incorrect information, and there's no way to avoid that sometimes.
Mhm.
I don't know about other hospitals, but we've learned this through the fact that parents have come back to us after the birth certificate has been processed because dad cannot get paternity leave because he cannot provide an acknowledgement of paternity form for his job. And then there's an amendment that has to be done. The hospital can't do it, but we'll write a letter to the Department of Health, have the parents fill out the AOP, witness it, and we usually send it to the corrections department for them to update the status from married to acknowledgement of paternity form. Is there any questions? That's how our system works.
No, that was very, very
Oh,
helpful.
I'm sorry. My colleague told me I'm saying paternity. I'm old school. I'm so sorry. Parentage.
Yeah.
There is actually one question in the chat. Anne-Marie was asking, if a parent does not present an ID, are they denied an AOP?
The father, we will allow them to email us the ID if they don't have it with them. Normally, we speak to the patient the day after delivery. That gives the father time to go home, leave the hospital, and come back with ID. But the dads are asked for ID because anyone can say they're the father and sign any Joe Schmo's name.
The next question, the follow-up question was, what if they don't have an ID?
I haven't really encountered where no one had ID, no ID at all. I'm not saying that doesn't exist. I personally have not encountered that.
All right, there's another question from Angela. I have a question. There are patients say that they are married religiously, but not through the courts. Is that considered legally married, or AOP needs to be filled out?
We fill out an AOP.
An AOP.
We encounter that. Actually, we've encountered more and more of that, especially in our Jewish community, where they'll say, we're not legally married. We just had a ceremony, but we're not legally married. And they actually want to fill out an acknowledgement of paternity form.
I have a question. And thank you for the insight on dads and their troubles with getting it through their jobs, and they have to come back to get it formalized into the system. My question is, we've heard that too from the facilities that we've met with. Either dads are away, they're not here, and they're traveling, and therefore they're not able to sign it right then and there. My question for you too is, in your facilities, have you encountered any like language barriers or dads that are literally not around and they're in a different country and they have to come back, and overall language barriers with your facilities, and how do you address those?
We have interpreter services where we can speak to anyone in any languages. In the room, in each patient room, there's an interpreter machine. But if we're in our office, we actually have a phone number that we can call and conference the patient in with any language that they speak. And that's been extremely helpful. Even if we have to meet them, say, in a conference room, we can dial into an interpreter. But we've also assisted patients where the dad is not here, but the dad is coming. Because we've had patients, say, delivered a few weeks earlier than anticipated. So dad is not physically here, but he is coming. We've had moms fill out their portion of the acknowledgement of paternity form, and we'll witness her signature and we'll hold on to it. And they'll say, dad is coming in, say, 8 days. He just booked a flight. We'll wait for dad, and then dad can come to the hospital on his own and fill out his portion. And we'll extend them past the 5-day window to accomplish this.
Sorry, there's another question. The question is there a way that the marital status question can be added to the birth registration paperwork? I know you probably don't have control over that. I'm not sure, Anne-Marie, if you're able to recommend that, or somebody else is able to recommend that to the state.
Well, don't you guys do your own in New York City? Isn't it a different system than the rest of the state, or is it all one system? The question is, does New York City, do you guys do your own birth registration paperwork, or is that the same that Department of Health in Albany uses. Well, somebody's asking me about the birth registration paperwork. If that's something that's governed by Department of Health, I could make the ask, but I thought New York City had their own process separate from Department of Health.
If the other parent on the AOP does not have a physical copy of their ID, can we accept a picture on the phone? And Sharon was saying, yes, we can accept a digital ID. Does everybody agree to that?
I would agree to that, certainly. And I would add that there is no legal requirement for parents to provide identification. So if there is a situation where someone claims to absolutely just simply not have ID, they cannot be denied the right to sign an AOP.
I'd like to ask this to Anne Marie. Basically, on in your line of work, what have you seen have helped families throughout this whole AOP process, and what has benefited families the most?
One thing I know has benefited families is, first of all, the implementation of the Child Parent Security Act. It has really made it so much easier for same-sex families and families using assisted reproduction to acknowledge parentage right from birth and not have to go through court as they used to. I also believe that the parentage mailbox has been a great resource that seems to be much appreciated by parents. I can tell you that almost on the daily, I have parents not only thanking us for the information they receive, but for the quick response. I think a lot of times when people send an email out to a government mailbox, they kind of think it's, sort of 50-50 whether they're going to even get a reply. And so when they receive a reply within typically a couple of hours, they're incredibly appreciative of the timely and accurate responses that they receive.
Thank you. And before we get to the open discussion piece, I do want to give a chance and thank Evelyn and Iris for their contribution. What we wanted to do is get a peer, one person from the facility to speak to these things, and such that you can see how they're implemented in real time and what are some takeaways that you all can get from that. But before we move to we have a question from Mariel. I'll allow her to speak.
Thank you, Mel. There was a question about, is there a way to add the marital status question to the registration paperwork? Silva B2 asked that question. So I was asking in response in the chat, are you asking if you wanted that question to be added to the mother-parent worksheet or just the hospital registration paperwork? Which registration paperwork were you referring to? If you could elaborate more on that question. If not, we can always touch on that later on during the discussion.
We were saying that generally is that question of marital status is part of the demographics when you're registering. So that's why we work very closely, right? So our registration team knows to always make sure to ask this question so we get the correct information. So generally, we have the registrar team ask when they're interviewing the patients and getting the patient's demographic, are you legally married? And they are also trained to explain why we're asked, being very specific about that question. So even if it's not on the form, it's a question that upon registration should be asked as part of the demographics.
Thank you for that. That's helpful. But currently, we cannot add marital status question to our electronic registration system. We cannot add it to the mother-parent worksheet, I don't believe. I feel like there's a law that I don't exactly remember when this was passed. This is probably old. There's a law. We're restricted about asking about marital status. That's why in the registration system in eVital, we ask about the person if they want to add another parent. We don't say what is your marital status, and then the options become yes, I'm married, yes, I want to add a parent. I forget the exact wording of the options, but we don't outright come out and ask about marital status because there is a law in place, I believe, that that really we need to be careful how we ask about that. That being said, and I'm glad to hear that, at least Rosa, Evelyn, your facility has a process in place as part of demographics when registering patients to ask about that so that you're able to make the determination to determine if they will need the AOP or not. So thank you for that.
Thank you, Mariel. And before we move on, I would like to also invite Evelyn, Rosa, and Iris to share just one last thing on what has worked well throughout your process, and what can people learn from, what can folks here and learn from your challenges and how you've faced them, and what is the biggest challenges in administering the AOPs?
So like Sharon shared before, we do work very closely, right? So the registration team is also under my supervision. So it starts from there, right? And then also, like Sharon stated, the nurses really also help. So because they're in and out of the room with the patient, if they hear something, they also will answer questions that they may know, or they'll put us in contact with the patient. If whatever information, the nurses we have a close relationship with them. So everybody's working together, and they know where we are. So either they'll call us or they'll go to our office and let us know, oh, XYZ patients wants to talk to you guys. They're confused about something, or, they're not really married, whatever information, any details that they've heard or they know of, they'll share with us. And then we'll also do our proper follow-up. So I think one of the main things is that it's all the teamwork, right, between all departments or all areas is one of the main things that I think has worked for us. I think Sharon stated it before that one of our challenges is mainly when we do want to reconfirm the marital status, the information with the patient, and they lie. That's something we can't control. We got to go by what the patient is saying and believe that they're being truthful. That's mainly one of the challenges, I would say. But other than that, I think we try our very best to get the most accurate information from patients so then we can do our part as best as possible.
All right. Absolutely.
Can I add something to that
Sure.
quickly? One thing that you might find helpful if you're trying to get folks to give you truthful information, I can attest to some major struggles that folks have when they're trying to obtain citizenship for a child like dual citizenship, because they will be asked to provide a marriage license if the mother and father or both parents are identified on the birth certificate and they are not producing the marriage license to demonstrate that they were married at the time of birth, then they will be expected to produce an AOP. And so a lot of times people are scrambling to try to get that. They have a meeting scheduled and they need to have it, and then they are upset that it's not going to get turned around in 3 days before the meeting. So that might be another thing to let them know that, in the situation, if they are trying to ever seek dual citizenship, they will be asked to provide that document if they can't produce a marriage license. That may just help encourage them.
Awesome. Thank you for that. And what I'm hearing too from the hospital, from Evelyn, is communication and making sure that we share information, and closing the loop between different parts of the different departments, and to maintain that continuity and that smooth transition in facilitating and administering those AOPs. So thank you for that, Anne Marie Yates and Evelyn. Now we're going to transition to the final part of the conference. Thank you all for tuning in so far. We're entering the final part, and this is more so like it's less formal. We want to hear from you all, and we would like to hear what do you think of this panel discussion and how realistic, as you can see, how realistic are these advice and what can you implement into your departments, and what are the things that are working for you, and what are some challenges that you face that we could hear from and you could share, and some lessons that we can all different facilities can take away. And what is your biggest takeaway from this discussion? So it's less formal. You could put it in the chat. You can lift your hands, and we'd like to hear your voice. And so please chime in.
Mel, this is Anne Marie again. I just wanted to let everyone know, I just put something in the chat. It's the address to the parentage mailbox and then requesting some other information. The reason I'm putting this here is because, as Alan mentioned before, I do 2 biannual training sessions. And there are 2 that I do for hospitals and 2 for registrars. So if any of the folks from the hospitals would like to be included in the listserv when I send out training invitations, please email your first and last name, your facility name, your PFI code, and your email address, if it's different from the one you're sending from, to the parentage mailbox. I will add you to my listserv, and then you will receive training updates in the future. We're just beginning to work with our partners at the Office for the Prevention of Domestic Violence to determine how to identify and address safety concerns that could arise when presenting or completing the AOP form. And we anticipate that addition in 2026. So if you would like to be included, please go ahead and do that. Your PFI code is, I'm sure someone at your hospital knows that code because every AOP has to have the PFI written on it. That's your hospital code. So if you don't know that, I'm sure you could ask one of your colleagues and they would know the hospital code. Thank you.
Thanks for that. Yeah. Also, before we get to this, please, please mention, if you could type in the chat, what hospital are you representing, so we know who's here. But yeah, we would love to know what advice that you would like to share for your peers, and what is working well in your hospitals that other hospitals here can take away. And we have all folks here too, so this is an opportunity to ask any questions. We have state, city, everybody here. Would anybody like to share a challenge? What's not working well? What are some common trends, some common themes of difficulty that you've been seeing in administering those AOPs? And you can type it in too. Okay, I want to refer back to a previous discussion that we've had. It was mentioned that Evelyn shared that in some cases that she's seen, the dad couldn't get approval from the job, and so they had to get proof, and they had to do a whole process to show proof. How how often have you seen that in your facilities? Anyone might like to answer that.
As people start contemplating, there is a question here from D. Reed. I'm going to ask them to unmute themselves, and they could ask the question.
Hey, good morning from University Hospital of Brooklyn. So the scenario is this: we had two 14-year-olds. Mom was 14, dad 14 delivered. Dad has no type of ID. And of course, we told him that unfortunately he couldn't fill out the AOP. How should we have handled that? Is that the best scenario, or what should we have done? Because according to the parents, he had no ID. The 14-year-old parents, he had no valid ID. And the 14-year-old mom wanted to add him on the birth certificate. So they're both 14.
Yeah, as I mentioned earlier, there's nothing in law indicating that identification is required to sign an AOP. And if that is the practice in your hospital to request ID, we would encourage you to continue to do that. However, someone cannot be denied the opportunity to sign an AOP simply for lack of identification. So I would suggest in the future, making sure that you are allowing them to sign.
Thank you so much for that clarification. I appreciate it.
You're welcome.
There was also a question in the chat about one of my challenges so far is parents who take the application home because they have not decided on the name for religious reasons.
Yeah, we've seen that. We've heard about that a lot too in our outreach efforts. It's not uncommon.
Just to clarify too, when people are signing as a witness, you're not indicating by signing that you're confirming the identity of the person signing. All you're doing is saying that I watched that signature be written. And then if something ends up to come up down the road, if there's something false or erroneous, that can be handled in court. But you are not liable for signing and not being able to identify that person. So if it's a liability concern, it doesn't need to be.
Mm-hmm. I see a question here. It says here, father needs to have two friends to sign for them as a witness. I guess the question is, can a father have two friends to sign for them as witnesses?
Any two people not related to either party can sign as witnesses. So it could be friends, it could be neighbors, colleagues, anyone.
Right, and Angela is referring back to this near the beginning of our conversation where we said that if somebody doesn't have an ID, is that a red flag? That we were talking about anybody can claim to be the father.
Again, I mean, that could be the case. There's no way to know for sure without ID. But if someone is opting to do something false or erroneous, again, they may have to contend with the results of signing a government document, falsifying a government document down the road. But that's not something the hospital is responsible for.
Okay. And so a lot of people in the chat are agreeing that, you can't force the ID if there is none. Okay, then we have a new one. We have a mom. We had a mom have her friend sign as the father, then have two more friends sign as witnesses.
Yeah, I mean, if that person who signed as the father was not in fact the legal father, if they're willing to be on the hook for 21 years of child support potentially, we can't prevent them from signing. But there are legal ramifications, because I hear about this often where I get questions in the parentage mailbox where people say that they know now that the person who signed is not the legal parent and they want it to be canceled. So then I have to explain to them, I look up the AOP in the Putative Father Registry and see the date. And as these are most often beyond the 60-day period for rescinding, they have to petition the court, and they're going to have to prove that it was signed under fraud, duress, or material mistake of fact. and the burden of proof is on the petitioner. So they may or may not be able to cancel. And that's why it's so important that people really understand the depth of what they're signing before they sign and what the potential ramifications of that are.
Anne Marie, so the friend who signed as the father, is that considered fraud?
It is, if somebody decides to dispute it. If, for example, the biological father or the biological other parent found out and suspected the child was theirs and decided to petition the court, then they could do so. And it may be overturned and the other person may be considered the father. But my bigger concern with that is, as I said, yeah, they're really good friends now. But what if they have a falling out in 2 years or 3 years or 5 years, and the person says that, well, I am really not the father? That may not be enough to have them removed from the AOP. If it's not in the best interest of the child, the court does not need to entertain that. So they may still remain on the hook for child support for up to 21 years of age.
Well, isn't it 21? Anne Marie, I have a question. It's not whether or not the father or the so-called father signing the AOP is the father or not. It's whether or not he's actually the person. The name that he's signing, is he that actual person?
Oh, so you're saying
asking for ID.
Okay.
That I think is the concern, not whether or not the person's the father and then 5 years later he's not the biological father. If we're not asking for ID, and I understand we don't have to, I totally get that. But if we don't ask for ID, how do we know the name that person is putting down is actually the person signing actual's name? Do that make sense?
It does make sense. And in that case, if, for example, let's say I'm the other parent and someone signs on my behalf without my consent, if I get something in the mail or find out somehow that I've been added to this form and I wasn't supposed to be, that would be considered material mistake of fact. And that would be, a reason that one could petition the court and potentially have, that would then generate probably a DNA or genetic marker test to determine whether or not that person added is actually the biological or intended legal parent. But again, it certainly is a best practice to get identification when you can. And as I know, I'm sorry, I don't recall your name. It was Evelyn's colleague who said that in all the years of doing this, has never come up has never seen a situation where someone couldn't produce any identification at all. I'm hoping that is not incredibly common. I'm just saying that if it is, there's no requirement in law for them to provide identification, and therefore they cannot be denied an AOP. If they are doing something false or erroneous, then they can contend with the court later on. Yeah. So then somebody said, but now that father has child support to pay, license suspended, passport revoked. That's something that, it's not as though the second that someone requests child support, that stuff all of a sudden, happens very quickly. You would expect that person, if they all of a sudden got a notice in the mail or they were called to court, because they'd have to go to court to get a child support order. A child support order doesn't just appear out of thin air. So they should have been summoned to court. If they were never summoned or can prove that they were never notified, if it does eventually catch up with them, they can go to court and dispute that, that they are not, say that they are not the person who signed the form. Again, and again, these are not great scenarios, but it doesn't change the fact that it's not a legal requirement. So if that changes, if legislation changes down the road, then it would be a different scenario. But that's how the law is right now. So that's what we need to abide by.
I would love to hear what's working well in one of your facilities. What does your workflow looks like? What I've heard from Anne Marie is a well tight knit. There's communication. There's being thorough and making sure there's the midnight to midnight, and folks are really getting things in, and they're reaching out to each parent to make sure to ensure their marital status.
I have a question for the moms that do not want to add dad, and there are moms that legitimately do not want to add the father. Do we need to write a comment letting you know that we did ask and mom chose not to add dad, so that when you do your percentage for all the hospitals out there, those percentages will come in as parents who didn't want to add dad or moms who did IVF because they're now want a child but don't have a dad in the picture? Do you need to also capture those moms?
Thank you for that question. And we do encourage the facilities to mention that in the chat section, in the comment section, sorry, that the mother did not want to add the dad to avoid like the back and forth as well. And capturing it in the data as well is something that we're working on, but to avoid the back and forth, that's incredibly useful. I don't know if folks want to add on that. Facilities as well. Muriel?
I'll mention that, that's Mel is right. Currently in the vital system, the New York City registration system, you can add a comment to reflect that the mother declined, does not want to add a parent, but we don't have a way to say that specifically. I think we have yes married, yes they will add, forgetting the wording, they'll add a parentage. And I think no might be the last option for whether they want to include a parent or not. But there's no option that will say declines to add, or it's just no, that they're not adding. But with the no, you don't know the subset of the ones that declined or refused. So they just don't want to add the other parent. So that's a limitation of the current system. But a comment would be very helpful.
So we have two comments in the chat. The first one is we always ask the mother after she delivers if she's married, and if not, we ask, do you want to add the baby's father to the birth certificate? And then the second comment, I'll let you, I guess, comment on both. Is it okay when the father is calling asking for a copy of the AOP that they signed?
As far as I know, if the father was added to the AOP, they should have been sent a copy of the AOP as well. Ali, could you clarify that, please?
I'm sorry, Muriel, can you repeat that?
Yes, you see the last question in the chat. It says, "Is it okay when fathers calling for a copy of the AOP that they signed?"
Oh yes, absolutely. So the father can call the newborn services unit and schedule a pickup to come pick up his copy of the birth certificate as well as the AOP if it's been returned to us. So he can give our office a call. I believe the number is 646 632 6543. Let me just verify that that's the correct number. Yes, 646 632 6563. And I also put that in the chat, but so they can give us a call. Our staff will check to see if the birth certificate has been returned back to us. And if it has, they can schedule a date and time to pick it up.
Oh, Ali, so is it the usual process that the father would normally be mailed a copy of the AOP and the birth certificate? It's just that some of them may be returned.
Yes, some of them may be returned due to various things. Maybe maybe the name wasn't on the mailbox, or the other various issues. Maybe the person had moved or what have you. So if in that case, then yes, it would be returned back to us. Otherwise, all father and mother copies, along with the AOPs, are mailed out to the address that we have on file.
And Ali, this may be a silly question, but how many are they allotted? Like, say, if the father who requested it loses it or something at some point, could they request it again? And how many? And do they have to pay for it?
So, yeah, exactly. Yeah. So we offer a free copy to the mother and the father for the newborn birth certificate. If that does get lost, then they would need to purchase a copy through the public service operations.
Thank you.
If the father is coming to pick up the birth certificate, we are located at 125 Work Street in downtown Manhattan.
I have a question from the chat. I think that the dad's calling the hospital and asking for a copy of the acknowledgement of paternity form. I think the person was asking if the hospital can give the father the copy of the acknowledgement of paternity form.
So they can probably give them a Word copy, but it won't be a copy from the DOH certified, essentially, with the deputy city registrar or the city registrar signature.
So we do have a message in the chat from Flushing Hospital. We've been noticing that the Spanish community is complaining that they're not understanding the Spanish translation of the AOP.
Thank you for that, Flushing Hospital. And we did hear about that quite often. And I came to understand that there's different versions of Spanish and different levels and stuff like that. So we have elevated that, and we've noted that concern. And you're not the only one to voice that. So thank you for mentioning. I don't know if folks want to respond to that on our end.
This is the first I'm hearing about that, and it is something that was done through our translation services at OTDA. So if anyone can share what the specific concerns are, and to the extent possible, if they know perhaps which country the person is from, because again, I do know that Spanish is spoken in a variety of countries and can vary from place to place. So the more we can identify, I can look into trying to get that corrected. We are looking to do an revision to the acknowledgement of parentage probably next year. And so we will be doing new translations at that point. So to the extent that we can identify what these issues are in advance of that would be extremely helpful.
One more comment about the Spanish community's complaint. From what I recall, I think the specific comment they were making was that it was sounding too legalese, if you could say. It was very formal. Someone else can correct me if I'm wrong. I think that's the comment that I'm recalling. It was a very formal Spanish that the community was having trouble understanding.
Correct. Yeah, and that Spanish differs from like the one from Spain and the one from like other countries throughout Latin America.
One thing I can say is that the language in the form comes directly from public health law and is not subject to change. So we can't change what's in the English form to make it less formal. So I'm not sure that we could affect changes to the translation, but I can certainly, send it up the flagpole and see who salutes.
And the Chinese form seems to have the same issue.
Okay, thank you.
You have what Chinese translations do you have? Do you have traditional Chinese or modern Chinese?
I do not know the answer to that.
Thanks.
Okay, we have another comment in the chat. We always ask the mother after she delivers. Oh, sorry, there was a comment to that one. So this was in response to, we always ask the mother after she delivers if she's married, and if not, we ask if she wants to put the baby's father on the birth certificate. And then there was a response to that from Alan saying, to respond to this question, can we please confirm the law in place that prohibits us from asking marital status? Is it an absolute prohibition?
I can look into that for you, Alan, and I'll share that when I find it, okay?
And Fran is saying, would one option be to make wording easier to understand and say exact legal language is not on the not on the opposite page? It's important for parents to understand what they are signing. Perhaps this is a way to address the issue and staying in line with the law.
So what you're suggesting, Fran, would be to have something to mirror the more legalese language that's written in plainer English?
Right. It seems like one side is kind of like the overall like overview legal page, and then the actual form is maybe simplified, I think.
I can certainly bring that back. It may be considered cost prohibitive, but I am happy to bring it back.
And yes, that is what Fran was recommending.
Okay, thank you.
Muriel stated that the DOH cannot ask marital status, not hospital staff. So I think you're saying that hospital staff could ask. Is that right, Nicole?
Yes.
Yeah.
Correct. The hospital is not prohibited from asking, but I think there is a law on the books. Don't have the specifics right now. There is a law that was passed a while ago that would prohibit us from formally asking, like, are you married? Yes, no. We just have to backtrack and find that. But there's nothing stopping the hospitals from asking about marital status. So please, if that's in your process, you can continue that.
Okay, we're gonna move on. Just want to thank you all for the rich discussion, from the panelists to our guest speaker, Evelyn Rosa, and her colleague, Ifo, and everybody who presented. This is a first of many discussions that we're going to have in the future. We're going to share an iterative version of this presentation to you all, and we'll continue the conversation. If you have any questions, our contacts will be on it if you don't have mine already. And thank you all. And before we close out, I do want to pass the mic to a friend who's going to share final remarks. So thank you all. And Fran?
So I too want to start by saying thank you to the entire State Department, the City Department of Health, OCSS, and OTDA team for pulling today's event together. And I want to thank everyone on the call for attending today's event, our conference. And I hope you found it to be meaningful and helpful to you when you go back to work. And I know you received a lot of information today. I want to make certain, though, if you leave with anything from today's session, you take away the following three, concepts. One is establishing parentage, lasts a lifetime for children and parents, and especially fathers. The role you play in the AOTPS process has lasting effects on New York City families. 2, getting information about the AOP process to parents as early as possible will help parents make an informed decision, and at the time the baby is born, they will not be hearing about the AOP for the very first time. I think that's an important piece that we did cover. And then lastly, AOPs must be completed thoroughly and correctly, because any errors will result in the AOP being rejected. So those are 3. I think there's many things that were important today, but those are 3 for me that rise to the surface. And I just want to remind everyone to please take the survey so we can improve future conferences. And thank you again, and have a good day.